before, I think this is a good time to start. I'd like to thank everyone for joining our webinar today for our September series for Suicide Prevention Month. We also are celebrating Hispanic Heritage Month. It does run from mid-September to mid-October. So we would like to, give a huge shout out to our Hispanic viewers and listeners. And we also just want to take the time to appreciate and highlight this month for all the great things that we can celebrate and commemorate, especially being that in Union County we are very diverse. So this is a wonderful way to also provide information on some issues that do touch every community, and specifically the Hispanic community for this month. So with that being said, my name is Safa Basadik. I'm a supervising prevention consultant for NJ4S, and we will be viewing the webinar that is going to be presented by Armando Beleno and Rachel Scarinci. They're going to be presenting on depression in the Hispanic community. So I will get to talk to you guys a little bit about both of them. So I'll start with Rachel. Rachel is a prevention consultant from the NJ4S Union Hub. She is a proud first-generation graduate student who will be graduating with her MPH in Global Public Health next summer. During her undergrad years, she obtained her Bachelor's of Science in Public Health along with a double minor in Science and Communication and Emergency Public Health Preparedness. She's passionate about educating others on preventative strategies, raising awareness, and bettering people's well-being. Ultimately, she enjoys empowering others by giving them tools and guidance necessary to tackle challenges confidently and autonomously. One of her favorite stories is about the lotus flower. It grows from muddy waters, but always emerges untouched and pristine. We are all lotus flowers, constantly being reborn through mud. It is up to us to wash away the dirt and blossom into beautiful flowers that we are. Rachel finds joy in watching Formula One races every weekend, working on cars, golfing with grandma, playing video games, and tending to plants with the help of her cat Mystic. So that is Rachel. Now I want to tell you guys a little bit about Armando. Armando is a 23-year-old graduate from Montclair State. He studied psychology. Armando also studied much psychology and has knowledge from adolescent psych to abnormal psych. I actually think he's 24. I may be incorrect here, right, Armando? He had a birthday.
No, you're right.
Armando is a music lover whose interests range from rap to K-pop. He's traveled to Nicaragua, Colombia, as well as other countries. Nicaragua and Colombia are where his parents come from. He's seen the despair of no mental health needs met. He hopes that eventually he'll be able to tighten the gap between those who don't have the means for mental help to seeking help. Armando has struggled with his own anxiety and depression and hopes to help other people with their mental health and repay what he's learned, and hopes to build a bridge of understanding and communication with others. So without further ado, this is going to be a special webinar series with the collaboration of both Armando and Rachel. So without further ado, I will turn it over. Thank you.
Thank you, guys. So yeah, today we're going to be discussing depression in the Hispanic community. Our table of contents. Today, we're going to be talking about prevalence and statistics. We're going to dive into disparities. We're going to talk about the call to action, the impact that COVID-19 had, the contributing factors of COVID-19. We're going to dive into barriers, documentation status, cultural factors, culturally responsive interventions, and lastly, we will provide some resources for everyone at the end. So, in terms of prevalence, in the United States, the Hispanic community has a notably higher prevalence of depression compared to other groups. And these depression rates can vary significantly among different racial and ethnic groups, For example, the Hispanic community has a notably higher rate compared to other groups. So as we see here, non-Hispanic white adults report about 21% of all depression, while Hispanic and Latino adults make up 14% of that. Non-Hispanic, Black, or African American adults make up 16%. Non-Hispanic Asian adults make up 7%, and non-Hispanic Native Hawaiian or other Pacific Islander adults make up 14%. And this disparity can be attributed to various factors, including cultural stigma around mental health, language barriers, and the limited access to mental health services. Additionally, Hispanic individuals are more likely to seek help from primary care providers rather than mental health specialists. And in terms of other important statistics here, 65 million individuals are within the total population of Hispanic individuals residing in the US, which makes the Hispanic community the second largest racial or ethnic group in the country following non-Hispanic whites. So with that being said, knowing that there is such a large prevalence, this is something that public health should be able to speak to. 1 out of 4 Hispanic adults will be faced with depression, and 40% of Hispanics have reported depression. So talking about disparities now as to why these rates are so high, there are access to healthcare issues. Hispanics are nearly 3 times more likely to be uninsured compared to non-Hispanic whites. This lack of insurance often leads to delayed or foregone medical care. We also see a lot of chronic conditions such as diabetes and asthma. According to the CDC, Hispanics are 66% more likely to develop type 2 diabetes than anyone else. Mental health is another access to healthcare issue because, again, as we were talking about before, depression rates are a lot higher in that community, and there's just a lot of cultural stigma and language barriers that can prevent individuals from seeking mental health care. In terms of economic disparities, when we talk about income and wealth, this is more so to speak towards the fact of depending on what Hispanic background you come from, it can affect you differently, similar with the depression statistics as well. But according to the CDC, Hispanics of Cuban origin tend to have a higher household net worth compared to those of Dominican origin. And Hispanic workers are also overrepresented in industries that were hit hardest by the COVID-19 pandemic, which led to higher rates of job loss and economic instability. In terms of educational disparities, educational attainment is something that we see a lot of issues with because this could kind of go back to the financial constraints that we talked about before, and this can limit their access to a quality education through K through 12. And then this also results in lower college enrollment and graduation rates compared to other groups. In regards to social disparities, language barriers, that's pretty straightforward, but in terms of the statistics, the CDC reports nearly a third of Hispanics are not fluent in English, which can limit their access to services, including healthcare and education. And then housing is something else that we saw. Housing, Hispanics tend to live in a overcrowded condition, which can impact their health and instability in the household as well. So speaking to some more key statistics that I would like to highlight, Hispanic women are more likely to report depression than Hispanic men. I think that might just be a general across cultures. That's even something that we've seen in other cultures. Women are just more likely to report their symptoms than men. The Hispanic youth are experiencing major depressive episodes, and like I said, depression rates vary among Hispanic subgroups. So now our call to action of how we can help combat these barriers and these stigmas and help change into a more positive outcome. We can increase awareness and reduce the stigma. So culturally sensitive education campaigns can help reduce the stigma associated with mental health issues and encourage individuals to seek help. We can also advocate for education, and this would be having programs aimed at reducing stigma around mental health and awareness of available resources to help encourage individuals to seek help. We can improve our access to care by enhancing access to mental health services. This one's really, really big because I think if we improve the access to care and everyone speaks the same language and we can help people get on the same page, that like just speaks volumes. But this also includes increasing the availability of bilingual and culturally competent mental health professionals, as well as expanding insurance coverage for these mental health services. We can also do community engagement, which engages community leaders and organizations to help disseminate information and provide support networks for those struggling with depression. And we can also advocate for policy changes that address social determinants of health, such as poverty and education, which can help mitigate some of the underlying factors contributing to depression in the Hispanic community. So now discussing the impact of COVID-19. So infection rates were 1.7 times higher in the Hispanic community compared to non-Hispanic whites. Hospitalization rates were 4.1 times more likely, and mortality rates were 2.8 times higher, which is just absolutely sad to say, especially during COVID. I think all of us are culturally competent, but not enough, clearly, based on these statistics. So there's still a lot that needs to change. In regards to the economic impact, there was a huge job loss during COVID. We saw that across every culture, every community. But in regards to Hispanic workers, particularly Latinas in the service industry, they faced significant job loss, which accounted for 23% of the initial job loss due to the pandemic, while making up only 16% of the civilian non-institutional population. And this economic hardship is disproportionately affected in Hispanic households, which exacerbates the existing disparities in income and employment that we talked about before. So in terms of the contributing factors to COVID-19, we saw a lot of work exposures because their employment did not allow for remote work. We briefly talked about the living conditions, but it made social distancing and quarantine measures a lot more difficult to implement. And there were higher rates of multi-generational living arrangements, which also increased the risk of spread to the older, more vulnerable family members. There were healthcare access issues. This hindered timely medical intervention. They also noted that there was a higher rate of being uninsured among all racial and ethnic groups during the COVID-19 pandemic. In terms of socioeconomic challenges, again, we talked about the higher rates of poverty and food insecurity made it difficult to afford healthcare and maintain healthy living conditions. In regards to the vaccination disparities, there was an uneven distribution of vaccines. So during the initial vaccine rollout, Hispanic communities faced challenges in accessing vaccinations due to factors like limited availability in their area, lack of transportation, and mistrust in the healthcare system. And language barriers speaks for itself pretty much. There was just a lack of medical staff or healthcare providers who were fluent in Spanish. And now going into barriers. So again, just not enough bilingual healthcare workers. There was a clear mistrust in healthcare because of the cultural misunderstanding of the Hispanic community, and the lack of insurance made it difficult to obtain health insurance and get the services that they needed to make them better. And now Armando is going to take over from here.
I just wanted to say thank you, Rachel, for that very informative first part of our presentation. And I want to say to Safa, you got my age right. I'm 23. Hey. But yeah, so let's pick up where Rachel left off, continue with the barriers. A lot of the barriers that, Latino Americans or Latino immigrants face is definitely not the exact same thing as, oops, my apologies. It's not exactly the same thing as, somebody that was born here. So, for example, a white person is not going to experience immigration stress, such as somebody who came here from a different country. So let's continue with immigration stress. I found a study that definitely reported that foreign-born Latinos living in the US, including those with US citizenship, reported having more anxiety and depression at times of increased immigration enforcement from 2011 to 2018. Now, the study measured enforcement by the number of detainer notices sent by federal authorities to police departments. This was all throughout the country, and it was asking them to hold non-citizens for possible deportation. Now, I think, kind of putting a group of people and saying, yeah, we got to hold these people, I don't think you really know the extent to where it goes behind that. So I feel like that definitely put up a wall, put up a barrier, and it really showed that, hey, like, maybe we should look into this deeper. Maybe we should look into what we're doing. Discrimination. Now, in response to increasing immigrant hostility towards Latino populations is growing. And it's very interesting to see that grow, especially because we've all said that we have come a long way since, saying, oh, we need to push these people out. But in recent years, we've seen that this grow more. Now, US-born Latino citizens, too, as well, they convey greater psychological distress in response to immigration issues. Their psychological distress scores were more closely tied to an increased public attention to immigration. Now, this measured that the volume of related Google searches was there than an actual increase in the enforcement. Now, I feel like as somebody who is both my parents are both immigrants, they both came here from different countries. I can attest to this because, not to get political, but when Donald Trump became president and this was pushed ever so heavily, I kind of got a little worried. And I was like, maybe I should pay attention more to the policies that are going on in my country just to ensure that my parents' rights don't get infringed. And, they both, luckily, my father has his citizenship and my mom has her status good to this day. So we're good with that. And referring to acculturation, this is a big barrier that we don't really see. We see it as like, oh, well, you're in a new country, you should learn the language, you should accustom to the culture, accustomed to the laws, accustomed to everything. That is true. But the strongest evidence points towards a negative effect of acculturation on health behaviors overall. Substance abuse, diet, and birth outcomes. So that means low birth weight or prematurely among Latinos living in the US. Next slide, please. I really want to hone in on this specific barrier, documentation status. I feel like we do speak about it often, but we don't really see the mental effects that it has on the community, because in communities, specifically this one, they don't really talk about it. They have this law. I put in quotations because it's not really a law, even though it has gotten a lot better in recent years with, the spread of accurate information instead of the false information. Culture plays a role when you're talking about the disparities, because between immigrants and US-born citizens, there is that line of like, all right, this is normal in my country, but it's not normal in this country. And that's why I like to bring into the conversation acculturation, because Previous studies show that racial and ethnic minorities are less likely to treat mental disorders or have different preferences in the treatment. Given their language barriers, stigma, and other cultural beliefs, since most immigrants have different cultural, racial, ethnic, and socioeconomic characteristics than the native-born white population, immigration status could potentially correlate with the race ethnicity to affect mental health care utilizations. So what does this mean for basically in the study? That your immigrated person from Colombia is less likely to go out and get treatment more than a native-born white person. Another big barrier is insurance. Although adequate access to mental health services can facilitate the adaptation process, lack of health insurance is a major deterrent or mental health care utilization for U.S. immigrants. I can concur this. I have my mom, she has a lot of friends who recently immigrated here from Cuba, and they kind of rely on her to like kind of show them the way because she has been here for, a good amount of time. She immigrated here from when she was a little girl. So she has basically been able to grow up American, and she has been able to kind of be accustomed to the insurances that we have here, whether it be Medicaid, Medicare, and the different ways we use those. Because, it might be very confusing to somebody who comes here from a country where they don't have this system in place and they're kind of confused by what's going on. So it's very important to have those people that are going to help guide them and help show them what's the next move. Let's hone in on cultural factors. Now, these three things, familismo, machismo, and cultural assimilation, are all three things that can help increase the disparities. So how do we lower these disparities? Familismo is it's a Latinx cultural value. It involves dedication, commitment, and loyalty to family. Now, I'm not, as somebody who has been brought up by two strong Latino Hispanic people, this has been ingrained in me for so long. It's basically, like we got to spend time with our immediate family and extended family. We have to show that love and we have to give them that important decisions. Now, I feel like familismo can be found in other cultures as well, but this is how we kind of hone in on our community as like, all right, well, this is what's going on right now. Now, machismo, I could write a paper about machismo. This irks me a little bit because it's something that presented in sets of heavily enforced gender norms. So an example of machismo is the woman has to tend to her man. Now, me, like, that doesn't suit well with me only for the reason that I feel like it's not ideal for anybody. Nobody else is benefiting from this. I feel like only the man is benefiting from this. And I am a believer where both people should benefit from this. So this idea of machismo definitely does weigh heavily on my culture. Luckily, my father, he has been very well on not passing this down to me. He does carry his machismo tendencies, as I like to call it. But at the end of the day, he sees that I'm not a perpetuator of this idea, that I'm very much an equal party. Everybody should do it. And last but not least, cultural assimilation. Now, we all know that this is the process where individuals, groups, or different ethnic heritage are absorbed into the dominant cultural society. If you didn't know, that's the actual definition of cultural assimilation. Most immigrants feel that by assimilating into a new culture, they are rejecting where they're from. And there is a lot of mental anguish here because you feel like you're kind of turning your back on the culture that you either grew up with. And one thing I do have to say about this is my parents, they tell me like, you don't know what it's like to come from another country. And that is true. But they try to keep ingraining, my culture into everything I do because they realize that in this country, I carry it as a person because, you look at me and you might see my skin color and you might hear my little accent of where I'm from. So they want me to be very well versed in it so that way I'm able to speak for the community and speak for everybody beforehand. Now, a big theme in Latino communities and Latino countries is pride. So imagine somebody telling you, you can't rep America, you gotta rep Greece, you gotta rep the United Kingdom. And you're like, yeah, but I'm from here. there's that sense of familiarity, that sense of belonging. And it's very difficult to find that in another culture that is foreign to you. So the next thing we're going to talk about is how can we bring interventions? How can we help? And I have a couple here. It's called Bridges to Better Health and Wellness. Now, this is a promising intervention that can help address some mental health care disparities faced by Hispanics with serious mental illness. Now, this is developed by psychologist Leopoldo Cabasa, and this program is a version of existing intervention of peak care. Now, this is developed and tested by Benjamin Druss of Emory University, and it's adapted to the Hispanic culture. So what does that mean? It was very much so given and well versed down to this specific culture because they noticed that there's a lot more disparities here compared to others. And I feel like in recent trends in Union County, we can see that there has been an influx of, immigrants coming in, especially because we work with the youth. We've seen it in the school systems. All right. And now, after this, we are going to move forward to more cultural responsive interventions. Now, a big thing that's big in the community is, the community is being with people who are, from the same community and having them help you. Now, community-based approach is considered to be a most effective method because it's been employed in Latino communities all across, involve the use of promoters de salud and social marketing campaign efforts. Now, I've seen this a lot because when my mom came here, she was greeted by a whole community in Hamilton Heights and my apologies, in the upper side of New York City. That's where she kind of grew up, and she was met with a whole bunch of people, whether it was blood-related family or a family that she met throughout. So I feel like genuinely this does help a lot because with our, culture, it relies a lot on promoting that whole family-based thing. And of course, relying on other people around you is the best source of reliance. Before we move on, does anybody have any questions about what we've spoken about so far? I know we've been kind of moving, either a little fast. All right, we are all good. I don't see anything in the chat as well, so we can just move forward. So now that we've given you all of the interventions and the way we can do this, I want to give out some resources. Now, I'm a big pusher of 988. I feel like 988 is one of the best numbers that you can call because if you're having any mental health need, they are there. It doesn't have to be like, oh, I need therapy, oh, I need connections here. They offer all that, but also they offer that listening ear. And they also have people who can speak Spanish if need be. There's also the American Society for Hispanic Psychiatry. I love to look at this because they are always developing new outreach material, new stuff to help the increasing trends of disparities for the Hispanic community. They collaborate with mental health professionals to better serve the Latino community, which I love. They advocate for improved policies and promote specialized research and education on Latinos' mental health. And last but not least, I feel like there is therapy there. It's easy to say therapy, but when it's geared to a specific community, there are community-based things that you can move forward with that. So there are therapies that are more effective. And what I found is a biopsychosocial model. Now, what that does is that it focuses on where you are as well as what's going on with you. So it manages everything through that social aspect that, we've talked about because it has worked the best with the Hispanic community. Now, before we go, I want to tell you guys a little story. It's about my mother, and it's basically about how she came to this country and how she had to deal with all the disparities, all of, the cultural factors and the barriers. And she came here when she was a little girl from Nicaragua, and she was thrown into the pool very fast. But what I mean by that is she was very much so needed to go to school fast. All her siblings were. And a story that she told me that always sticks with me, that she says that I made up, but I swear she told me this. Because like, why would I make this up? It's so crazy. So she was in school one day and like they would make fun of her for what she was wearing. They would call her Raggedy Ann. And I'm not gonna lie, I cackled when I first heard this because I didn't understand. But when she explained to me why like it's so important to keep yourself, clean, to keep yourself right, is because of this moment in her life. And when I taught her that, she's like, I don't remember that happening. And I was like, well, you told me about it when I was a little kid. You said that you went to school one day and the kids were making fun of you and they were calling you Raggedy Ann and they were making fun of your clothes. And she was like, I guess I kind of don't remember that. And I'm like, but if you also really think about it, it does make a difference. Because the way you tell me things, the way you've raised me to be very much so, you have to be on point, you have to dress right, you have to have good hygiene. It's all because she doesn't want that to happen to me. And I see it now more than ever as, an adult working in this profession. So, do we have anything else planned for them?
Mm-mm.
So does anybody have any questions regarding what we spoke about, either the biopsychosocial model, the prevalence, or any disparities? All right.
All right. Well, then, thank you guys so much. I know we threw a lot of information at you, but thank you so much for listening and being receptive to this information. And yeah, I just want to thank everyone and enjoy the rest of your afternoon.
And we're gonna throw it back to Safa.
Yeah.
Thank you both for such a information-packed presentation, especially during this month. And again, I know that we can all benefit from this type of information, especially when we, work with such a diverse county such as Union. So again, thank you so much. I would like to just remind everyone that there is a link in the chat. If you'd like to give feedback for Armando and Rachel, please feel free to do so. It really does help us get a picture of how we can best present to our audience, and possibly if you would have any type of suggestions or anything that you would like to see, you can also send us an email at nj4s@preventionlinks.org. Please do not hesitate to follow us on social media. Our social media on Instagram and Facebook is NJ4S Union Hub. And I just want to remind everyone that next week is our final part of our September series. That will be presented by Tahani, and it will be a pre-recorded offering, and it will be located on YouTube. So please do us a favor and follow us, keep up with us, check us out on YouTube, social media, and we will see you in October. Thank you. Bye-bye.